For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
All right, good morning, everybody. My name is Ricardo Romero-Morales. I'm a lead public information officer for the County of Santa Clara. Thank you so much for being here today for today's press conference. It is an honor to see every single one of you today. And today we're going to be providing an update regarding vaccination efforts here in Santa Clara County. Today we're joined by the following speakers. President Mike Wasserman, President of the Santa Clara County Board of Supervisors. Dr. Sara Cody, Health Officer and Director of the Public Health Department in the County of Santa Clara. Dr. Marty Fenstersheib, COVID-19 Testing and Vaccine Officer from the County of Santa Clara. Dr. Rocio Luna, Deputy County Executive in the County of Santa Clara. Supervisor Cindy Chavez, Santa Clara County Board of Supervisors. We will start this press conference in English and American Sign Language. We will then move into a section of questions and answers, and where speakers will repeat the question before answering for the purpose of our Facebook Live audience. We will then move into statements from the podium in Spanish, Chinese, Vietnamese, and Tagalog. Without any further ado, it is my honor to introduce President Mike Wasserman.
Thank you very much. Good morning, everyone. Thank you all for being here. With 2 million residents, Santa Clara County is one of the largest and most diverse counties in the nation. Creating an infrastructure practically overnight to vaccinate this many people was a Herculean task, but we did it. Through a vast network of partnerships, like the one with the 49ers, we have achieved a very significant milestone today. 1 million first doses given to Santa Clara County residents. That's happening right now, today. As many of you know, I'm a numbers guy. But celebrating this 1 million number is about celebrating and acknowledging people. It's about our frontline heroes who, for more than a year, have been giving up days off, much needed sleep, and their own well-being to care for complete strangers. Today is about thanking every person who has helped us get to 1 million doses and set us on our healing course. And we also want to thank the 1 million plus community members who have done their part and already received vaccine. But we are far from done. Many appointments are available to receive the vaccine. I appeal to the community members who haven't already to please schedule your vaccination as soon as possible. Simply go to www.sccfreevax.org. Help us get to the next milestone and the restoration of normalcy in Santa Clara County. Thank you again for being here, and now I yield my time to Dr. Sara Cody.
Thank you, Supervisor Wasserman, and good morning, everyone. I'm Dr. Sara Cody. It's lovely to be with you all, as always. And I'm really thrilled to be here today because it's such an important milestone. Over 1 million of our county residents have received at least 1 dose of the vaccine, which is phenomenal. And we need to take a moment and take a deep breath and really celebrate. This is a really big deal, especially because the vaccine hasn't been available in our community for that long. And remember, it started in mid-December, but with just a trickle. And it's just recently that we've had plenty of doses to go around. So after so many long and difficult months, we can now see a very clear path out of this pandemic. So vaccination is critical. It's critical to keeping our COVID rates low, and it's critical to keeping those new variants at bay. At the county, we will continue to focus our efforts on equity, and that is ensuring that everyone, no matter who you are, has equal opportunity and equal access to vaccines. And we are committed to ensuring that we remove whatever barriers exist to ensure that everyone eligible for a vaccine receives a vaccine. So with the increase in supply, we have plenty of appointments available. And I really encourage everyone who's eligible and has not yet been vaccinated to get vaccinated. And I know that some people are still unsure and a little bit on the fence and just waiting to decide whether to get vaccinated. And here's what I want to share. So one, please reach out to people who are ready sources, have information that might be helpful to you. It might be the county. Our website, sccfreevax.org, has a lot of information. Perhaps community partners, healthcare organizations, faith communities, or other organizations might have information that would be helpful to you. We encourage you, if you have a trusted healthcare provider, talk this over with your healthcare provider. Talk with people who've already been vaccinated and see what their experience has been. Maybe it's a friend, a neighbor, or a family member. I can tell you as a physician, as a mom, why did I get vaccinated? I got vaccinated because I was concerned about my county family here with whom I spend a lot of time. I didn't want to introduce the virus to my loved ones right here. I didn't want to introduce the virus to the family that I live with, to my spouse and my children, or to my mom who's in her 80s, or to her husband who's also older. I wanted to protect them. That's why I got vaccinated. The vaccines are quite safe, incredibly effective, and now widely available. So there are paths towards our pre-pandemic life, being able to relax a little bit and go back to the activities that we so cherish. So if you're one of the 1 million that's already started your vaccination series, fantastic, thank you. And if you're someone who is still waiting, ask a lot of questions and then schedule your appointment. Now I want to pass this over to Dr. Marty Fenstersheib, our COVID vaccine and testing officer, and our former health officer, Dr. Fenstersheib.
Thank you, Dr. Cody, and everyone else, Supervisor Wasserman, Supervisor Chavez. I am really happy about this. This is just remarkable. I never thought when we first started this effort that we would be here today, still in April, and being able to say that we have reached 60% of our population with at least one dose, and over a third of our population eligible who have completed the entire series and are fully vaccinated, and that equals 1 million doses. We still have a ways to go. And we're celebrating today, but we still have a ways to go. As we always say, the first million is easy, and the next 500,000 is going to be a little tough. We know that people are concerned about the effectiveness of the vaccine, the safety of the vaccine. They've been waiting, but I say to them, wait no longer. Join the million of your community family, your neighbors, your friends, and get vaccinated. This has been a Herculean effort. Not just the county is doing this, although the county has led and doing the bulk of the vaccines. But we appreciate our partners, our community health clinic partners, as well as our larger providers, Kaiser, PAMF, El Camino Hospital also, because it's an effort for all of us. We also have a lot of the retail pharmacies joining the effort, and we encourage people, as was mentioned, to go on the vaccine website, sccfreevax.org, and look for your provider or pick any providers, as we have a no wrong door policy. Again, also you can find a link to the retail pharmacies there also, maybe one of your neighborhood CVS, Costco, Walmart, or Walgreens are also providing vaccine. So again, I want to join Dr. Cody and Supervisor Wasserman to again celebrate this moment, but to also realize it's been a joint effort. It's a community effort. We appreciate the patience of the people in the community that have waited for their turn and have followed the directions and eligibility criteria as we have come a long way. We hope that we will be able to continue our effort, and hopefully by early in the summer we will complete our effort. But again, urging everyone, please get vaccinated, especially those 16 and 17-year-olds who are also eligible at this point. Come on down, bring your family, and get vaccinated. And I'll now turn this over to Dr. Rocio Luna.
Thank you, Dr. Fenstersheib. Good morning. My name is Rocio Luna. As we reflect on this exciting milestone in our historic fight against COVID-19, we cannot forget the structural inequities and barriers that have led to significant disparities in COVID-19's impact. Our communities in East San Jose, South County, our Latinx community, our African ancestry community across the county have been particularly hard hit by this pandemic, facing high rates of cases and deaths. We know that structural barriers such as discrimination, racism, xenophobia, access to technology, transportation, and linguistic and cultural barriers have meant that this is a much harder vaccine to access for many of our residents. Because of that, our county has centered equity as a central component of our vaccine strategy. More than 16,000 community members have received their vaccination through our door-to-door outreach efforts in our hardest hit census tracts. We also have 5 mobile pop-up teams providing vaccination clinics most days of the week, and we are pivoting this strategy to ensure that vaccine appointments are available on a walk-in basis during evenings and weekends. We won't stop until everyone who is eligible has been offered a vaccine. Our recovery as a community depends on this, and we will redouble our efforts to ensure that we close these gaps. And to make this possible, we need your support and your help. Next, I'll introduce Supervisor Cindy Chavez.
Well, good morning, everyone. And I wanted to just say that how much I appreciate President Wasserman reminding us that this was an opportunity to tell you how far we've come. And thank you very much for that. And I also just want to say to all the folks who've been working to get folks vaccinated, a very, very sincere thank you. And for all of you who got vaccinated, a very, very sincere thank you. Here's what's exciting about where we are today. When we look at 49ers Stadium that has the capacity to vaccinate 15,000 people a day, we've got that in Santa Clara, we've got our partners at Stanford vaccinating in North County, and in the East Side and in Gilroy, we've got mobile sites, pop-up sites, locations at churches and schools. You almost have to avoid getting a vaccine now. You got to get in there. Now, here's what's great about where we are now. We have enough vaccines to not only make sure that those big sites are taken care of, but every site in our community has appointments right now. And you can get an appointment as early as 7:30 in the morning. And I think the latest we're offering is still 7:30 at night. You can get them on Saturdays and you can get them on Sundays. If you go to seccfreevax.org, what you're going to see are lots of opportunities and options. And we want to make it as easy for you to get vaccinated as possible. If you can't use a computer, and I'm not calling my mother out, but if you can't use a computer, sorry mom, you can dial 211 and you can talk to somebody, and we're going to get somebody in a language that you can understand. So if it's not English, tell us what it is and we will help sign you up. And then the other thing is, out in the community, we've got literally 100 people walking door to door or going to businesses to sign people up to get vaccinated. When they come to your door, open your door, sign up with them. They're going to make it easy as we can make it for you to do that. I just want to close with this point. I love living here. And I think, Mike, you said it best when you said, like, we're one of the most diverse places in the whole country to live. And the fact that we've gotten 1 million shots into people's arms is just, it's beautiful. But we know that in order to beat COVID-19, we have to get everybody across the finish line. So we need everybody's help in encouraging the people who are still in need, people who need a ride. We even have free rides. VTA will take you there for free. So join us in making sure that we're all vaccinated and that this is not only one of the most diverse and wonderful places to live, but it stays one of the healthiest places for us, no matter where you live in our community. Thank you.
We'll now take questions from the English media before moving into the Spanish language portion of the program. We'll start with KPIX. Please identify for who your question is for.
Hi, this is for Dr. Cody, please. Thank you. Dr. Cody, the CDC is reportedly reevaluating wearing masks outdoors, especially in open spaces such as parks and such, bike lanes and walking paths. What is your local guidance on that today?
The question is around local guidance on wearing masks outdoors, given recent communication from the CDC. What I'll say is this: in Santa Clara County, we are pretty much aligned with the state and with the CDC. So we're not going to have local guidance that's different than the state and the CDC. I think the issue of I'll say that we are in a transition phase. As more people become vaccinated, we can begin to peel off some of the other prevention measures, but not too soon. So it is true, when you are outdoors, it is much safer because the virus can disperse in the air. The more people that are vaccinated, the less chance that someone's going to be infectious. And so there is going to come a time where it's going to feel safer and safer to take your mask off. However, we don't know who's vaccinated and who's not. And it is still the safest thing to, wear a mask when you're close to people who are not from your household. Thanks.
So your recommendation today is to keep them on?
My recommendation today is always err on the side of keeping your mask on. However, if you're outside and there's someone around that's not wearing a mask, you're probably at very low risk, right? Because 1, you're outside, 2, our vaccination rates are going up, and 3, our COVID rates are going down.
ACBS? Matt Boone with ACBS. The FDA is apparently getting closer to making a decision on the Johnson & Johnson vaccine. How does that factor into the next couple of weeks of trying to get more vaccines out to the community if they do reapprove it?
The question is around the J&J vaccine. Today, ACIP is meeting. I think they're in fact meeting right now. I've not heard that there's any result from their meeting as yet. We will, of course, embrace whatever guidelines and recommendations the ACIP provides to us. Regarding vaccine supply in Santa Clara County, we now have plentiful supply. We have lots of Pfizer and lots of Moderna. So there's no limitation on availability for anyone to get vaccinated.
NBC? Robert Connie with NBC in the area. For Dr. Cody or Dr. Marty. 1 million doses. Can you give us an idea how that fits into the context of herd immunity? When I was talking with Dr. Clowney today, we were really struggling because there seem to be so many different factors that you can include or not include, including youngsters, etc. How does this 1 million doses fit into reaching the goal of herd immunity?
I can start off, and then Dr. Fenstersheib should fill in anything that I miss. Should I wait for the... The question is regarding herd immunity and how does our 1 million people having launched on the vaccination fit into herd immunity? So the estimates of what is herd immunity, what percentage of the population needs to be vaccinated, changes. The estimates have been anywhere from 70% to 85%. So it's not crystal clear exactly what that number is. What we know is that a third of people 16 and over are fully vaccinated, and about 2/3 of people 16 and over have at least one vaccine. We also know that younger age groups are less likely to spread the virus, so maybe it's more okay that they're not eligible to be vaccinated. So I don't have a definite number. Dr. Marty?
I don't have any additional information as to what the actual percentage for herd immunity is, but I do know that at the rate that we're going, we could actually get everybody vaccinated by the end of June. However, it worries me that, as I mentioned, the second part of the 40% left is going to be much more challenging. We have people that are hesitant about getting vaccine. People are worried for various reasons. People also have issues with access to getting the vaccine for various reasons. There are other barriers, and also issues around making sure people get their second shot, that they come and get their second dose. So in all best worlds, we would get finished by the end of June. It's going to take us longer. Again, with adding additional age groups, eventually we can get up to at least 85%. But again, the more people that get vaccinated, the safer it's going to be, the less chance for viral spread, the less chance for mutations and additional variants. So the closer we get, the safer we are, and hopefully we'll get everyone vaccinated in the next several months.
I don't know if you addressed it while the plane was flying. So is there not really much focus then on achieving herd immunity mark and just really sort of focusing on getting to either 85% or everybody by the end of June?
Well, I think it's really important talking about herd immunity that, again, we're not an island. So having herd immunity in your neighborhood is not good enough because we live in a community. Having herd immunity in our county is not good enough because we live in a state. And herd immunity is not good enough in the state because we live in the United States. So, I mean, it grows. It's a global issue. And so we have to work globally to get as many people vaccinated and not just rest on what we can do in our own community in order to be safe totally.
This question is from Dr. Cody from Santa Clara County. We talked to a lot of people from the Hispanic community, and they have a couple of concerns as far as what they told us. One is that they said that the appointments available are during their work day, and that they wish there were more appointments, or at least that they don't know if there's appointments available after 5 or 6 p.m. One of the questions would be, are there any change in the strategies to have appointments available for people who work like a normal 9 to 5 and they're not available during that time to go get the vaccine, specifically for the Hispanic community?
Thank you for the question. The question is around basically vaccine appointment availability during non-working hours. We are working to make those that time available. We do know that evenings and weekends are really critical time to have vaccination available. Rocio, do you have any particulars you want to add or share regarding vaccine availability?
Hi, thank you for the question. We absolutely know that our Latinx community is back at work. They never stop working, and we absolutely are moving to ensure that vaccine appointments are available in the evening and on the weekends. We'll be doing focusing in South County and in East San Jose, and our fairground site also will be having appointments available, walk-up appointments until like 9 o'clock at night, starting late, going into the evening. Again, making it really easy for people that are working during the week to get vaccinated. Thank you.
We're hearing there's an excess of vaccine in the pop-up and walk-up sites. Are you making any changes to address this?
The question is around excess vaccine in pop-up and walk-up sites. Our strategy is we're doing lots and lots of outreach, including going door to door to see whether there's anyone in the home that hasn't been vaccinated that would like to be vaccinated. lots of different ways that we're spreading the word. So when we do see that there's excess capacity in a pop-up, we usually go back and redouble our efforts to ensure that we increase outreach to get those slots filled.
KPIX?
Yes, Dr. Cody, you mentioned the Moderna and the Pfizer vaccine readily available here, but how much has the Johnson & Johnson being placed on hold, how much has that kind of hurt, if at all, in terms of people feeling safe about vaccines in general, and have you noticed any kind of impact because of that?
This is again the question around the impact of the J&J pause. I wouldn't say that we've experienced any big impact. I mean, we do miss having the J&J available because for efforts where it's difficult to get someone to return for a second dose, the J&J is a wonderful, wonderful vaccine. The Pfizer vaccine still requires that very cold, ultra cold freezer. And so it's logistically more complicated to get it out. So that's really the main thing that we've noticed. I want to just say that I think that the caution with the J&J vaccine to pause until there's more conversation and more data gathered is really, really important. And this is part of the commitment to ensuring that there are safe and effective and carefully evaluated vaccines available to the public. So I think the pause is a really good thing.
Final question from NBC.
In terms of the 1 million doses, do we know how many people outside Santa Clara County may be part of that group? Or is it a significant amount? I can't remember exactly.
Right. The 1 million doses, these are 1 million doses among people living in the county because these data come from the state immunization registry. They're pulled from there by where people live. That's correct, yes. I am accurate. Just double checking, thanks.
All right, thank you, everybody. That will conclude our English and American Sign Language portion of the press conference. We will now be moving into Spanish. Muy buenos días, mi nombre es Ricardo Romero-Morales, soy oficial principal de información pública para el Condado de Santa Clara. Esta mañana acabamos de anunciar aquí en el Condado de Santa Clara que hemos alcanzado un peldaño muy importante. Aquí en el Condado de Santa Clara hemos alcanzado un peldaño muy importante, el cual es que los esfuerzos de vacunación han sido tan fuertes que hemos ya alcanzado 1 millón de miembros de la comunidad quienes ya han recibido al menos su primera dosis de vacunación. Esto es 1 millón de personas que viven aquí en el Condado de Santa Clara quienes ya recibieron al menos su primera vacuna. Eso significa que más del 62% de los residentes mayores de 16 años han recibido al menos una dosis. Más de 500,000 de personas, aproximadamente 1/3 de la población del Condado de Santa Clara, ha ya completado la vacunación, esto es, las 2 dosis. Hoy aplaudimos a todos los enormes esfuerzos de nuestros trabajadores, agencias comunitarias y todos nuestros voluntarios quienes han hecho esto posible. Muchas gracias. Sobre todo, tenemos que celebrar a la gente, a nuestra comunidad, quienes han tomado la decisión de ponerse la vacuna. Muchas gracias. La vacunación es fundamental para mantener las bajas tasas en los bajos números de COVID-19 aquí en nuestro condado, tanto en nuestra región. Es por eso que también es muy importante que se vacunen, especialmente cuando vemos variantes del virus circulando en nuestra comunidad. En estos momentos tenemos suficientes vacunas para todas aquellas personas quienes se quieran poner la vacuna. Si usted ya se puso la vacuna, le motivamos a que usted hable con las personas, con sus amigos, con sus familiares y le eche la mano haciendo una cita, dándoles un ride, llevándolos al sitio de vacunación. Cualquier cosa que usted puede hacer eso aumenta ese granito de arena para que todos podamos salir de esto juntos. El condado de Santa Clara continúa con sólidos esfuerzos para cerrar la brecha de la equidad de vacuna. Como sabemos, las áreas del este de San José y el sur del condado son algunas de las áreas quienes han sido más afectadas en nuestra región aquí en el condado de Santa Clara. Y es por ello que también hemos duplicado los esfuerzos que estamos haciendo para llegar a estas comunidades, tales como ir de puerta en puerta para educar a la comunidad acerca de cómo vacunarse, resolver cualquier pregunta que tengan acerca de COVID-19, también acerca de las pruebas. Es muy importante también recordarle a la comunidad que si alguien toca a su puerta, no vamos a pedirle su número de seguro, tampoco ni su número de tarjeta de crédito. Todos nuestros esfuerzos y toda la ayuda es completamente gratis y no importa su estatus migratorio. El condado está trabajando para garantizar la ampliación de los horarios nocturnos y fin de semana. Esto nos va a ayudar también a llegar a aquellas comunidades quienes trabajan durante el día y no pueden llegar a su cita. Es por ello que vamos también a expandir los sitios donde no se requieren cita, expandir las horas y expandir durante los fines de semana. Nuestros sitios, quienes van de puerta en puerta tocando y educando a la comunidad, han podido ya agendar citas a más de 13,000 personas quienes viven aquí en el condado de Santa Clara. Es muy importante también recordarle a la comunidad que ellos pueden hacer una cita a través de nuestro sitio web, el cual es el sccvacuna.org. Y si usted no tiene la tecnología para acudir a un sitio web, usted puede llamar al 211, donde un operador le podrá asistir en hacer su cita. Sabemos que estas vacunas son seguras, eficaces y poderosas al mantenerse a sí mismo, a su familia y a su comunidad a salvo. También, si usted está muy dudoso o aún no está seguro si ponerse la vacuna, es muy importante recordarles que usted puede visitar uno de nuestros sitios web para encontrar más información. También puede visitar la página de la CDC. También puede consultar con un amigo, con un vecino, con su comadre, quienes ya se hayan puesto la vacuna, para hablar un poquito más acerca de la vacuna, los síntomas y qué es lo que usted tiene que hacer. Personalmente, como trabajador de salud pública, me puse la vacuna para proteger a mi familia del trabajo y a mi comunidad. Es muy importante que usted también haga un poco de su parte para que juntos podamos llegar al final de esta pandemia. Muchas gracias. I will now go ahead and transition into Vietnamese statement from the podium. We can do Chinese next, yes. All right, go ahead and do Chinese and Chan. If you can please come to the podium. Thank you.
大家好，我是圣塔克拉拉县紧急行动中心的 Chan， 在此宣布重要的新冠疫苗讯息。圣塔克拉拉县在这周迈入了疫苗接种人数的100万里程碑。自2020年12月疫苗施打开始，到目前开始所有16岁或以上的人士接种，已经有超过100万人接受了至少1剂的疫苗，占此人口的62%。而在160万符合接种疫苗的人口中，有1/3已经完成了完全接种。虽然已经有了100万县民的参与，我们对于防疫还是不能松懈，需要所有民众的配合，继续的戴口罩，和他人保持一定的距离，并且去接种疫苗。圣塔克拉拉县持续的努力来结束不公平的差距，在东圣河西河县的南部，那些被疫情影响最严重的社区，都看得见圣县社区推广小组的身影。县府也努力增加晚间和周末的疫苗预约时段，以及流动的疫苗站到交通不便的社区，让民众能够更便利的接种疫苗。目前的疫苗预约时段非常的充裕，而且县府随时都会增加新的时段，请大家上圣县疫苗网页 sccfreevax.org 去预约打疫苗。为了服务华人的社区， 用中文能够直接协助需要帮助预约的民众。在今天下午5点到7点将开放中文的疫苗热线，需要协助预约打疫苗或者是对疫苗有疑问的民众，可以在今天下午5点到7点打电话到408-970-2999 408-970-2999。任何消息与更新，请上圣县的网站 www.sccgov.org/covid19， 可以选择中文的页面。最后，祝大家平安健康。Next, Lee will be providing a statement in Vietnamese. Thank you.
Chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Kính thưa quý vị, ngày hôm nay quận hạt Santa đã mở một buổi họp báo để đưa đến cho quý vị thông tin về việc quận hạt của mình đã đạt được một cột mốc quan trọng trong tiến trình tiêm ngừa COVID-19 cho cộng đồng. 1 triệu người từ 16 tuổi trở lên đã được tiêm ngừa ít nhất một mũi trong hạt Santa Clara kể từ khi mà chúng ta bắt đầu cái việc tiêm ngừa này từ tháng 12 năm 2020. Điều này cũng có nghĩa là đã có hơn 62% cư dân từ 16 tuổi trở lên đã được tiêm ngừa ít nhất một liều, và hơn nửa triệu người, khoảng 1/3 dân số đã được tiêm ngừa đầy đủ. Tổng số người hội đủ điều kiện được tiêm ngừa trong quận hạt của mình là 1,6 triệu người. Rất vui mừng vì chúng ta đã đạt được một cột mốc này. Ngày hôm nay chúng tôi muốn gửi lời cảm ơn đến các nhân viên y tế, các tổ chức cộng đồng đã cùng hợp tác với chúng tôi, các nhân viên tiếp cận cộng đồng và tất cả các thiện nguyện viên, những người đã tham gia vào nỗ lực tiêm ngừa. Đồng thời cũng cảm ơn quý vị đã thực hiện vai trò của mình đi tiêm ngừa khi đến lượt, và chúng ta hãy tiếp tục cùng nhau, cùng đồng hành với nhau để tất cả chúng ta có thể cùng vượt qua đại dịch này sớm hơn. Các viên chức y tế nhấn mạnh rằng dù cho là mình đã có 1/3 cư dân đã được tiêm ngừa đầy đủ rồi, nhưng chúng ta vẫn không được lơ là, vẫn phải mang khẩu trang, vẫn phải giữ khoảng cách an toàn và thực hiện những biện pháp an toàn COVID-19 và đi tiêm ngừa khi đến lượt. Tiêm phòng rất quan trọng, giúp chúng ta có ít rủi ro bị bệnh nặng vì COVID-19, đặc biệt là khi chúng ta phát hiện ra rất là nhiều biến thể mới đang lưu hành trong cộng đồng của mình. Hiện nay có rất nhiều cuộc hẹn được mở ra và chúng tôi có đầy đủ thuốc để cung cấp đến cho quý vị. Hãy đặt hẹn hoặc đi đến những địa điểm walk-in, không cần đặt hẹn để được tiêm ngừa. Chúng tôi vẫn đang cố gắng đưa đến tiêm ngừa cho những cộng đồng bị nhiều ảnh hưởng nhất vì COVID-19, như là cộng đồng ở phía nam của quận hạt hoặc là phía đông ở San Jose. Chúng tôi có nhiều nhân viên đến tận nhà gõ cửa để hỗ trợ đặt hẹn, tiêm ngừa tận nhà cho những ai hội đủ điều kiện, mở ra những địa điểm tiêm ngừa gần với chỗ làm hoặc là nơi sinh sống của cộng đồng. Và đồng thời chúng tôi cũng mở ra một cái tổng đài đặt hẹn tiêm ngừa cho quý vị. Chúng tôi có một cái số điện thoại về vaccine COVID-19 là về việc tiêm chủng. Nếu như mà bất kỳ quý vị nào có muốn được hỗ trợ thì quý vị có thể gọi vào cái tổng đài này ở số 408 970 2999. Thì cái tổng đài này hoạt động từ 7 ngày trong tuần, hoạt động từ 8 giờ sáng đến 5 giờ chiều. Tuy nhiên chúng tôi có làm thêm giờ để mở ra những cái tổng đài có thể nói được nhiều thứ tiếng khác nhau để quý vị có thể gọi vào dễ dàng hơn. Thì chúng tôi ngày hôm qua mới mở ra một cái tổng đài tiếng Việt là vào lúc từ 5 giờ đến 7 giờ thì đã giúp cho rất là nhiều người đặt được hẹn. Và nhân đây thì Khánh Ly cũng muốn cảm ơn tất cả các đài truyền thông và cũng như là tất cả các quý đồng hương đã cùng chia sẻ cái thông tin này để mình có thể đưa những cái thông tin hữu ích này đến được với nhiều người hơn và giúp được nhiều người đặt hẹn hơn. Và nhóm của Khánh Ly cũng đã quyết định là bắt đầu từ tuần này thì chúng tôi sẽ mở ra cái tổng đài tiếng Việt này mỗi thứ 5 hàng tuần vào lúc 5 giờ chiều đến 7 giờ tối. Thành ra là nếu như quý vị có bạn bè hoặc là người thân thì hãy chia sẻ những cái thông tin này ra để nhiều người biết được cái thông tin này hơn, và chỉ cần gọi vào cho chúng tôi ở số 408 970 2999 408 970 2999 vào mỗi thứ 5 hàng tuần vào lúc 5 giờ chiều đến 7 giờ tối thì chúng tôi sẽ có nhân viên nói tiếng Việt hỗ trợ quý vị. Xin cảm ơn. And now Sirian will provide message in Tagalog.
Magandang umaga po sa inyong lahat. Ako po si Sirian Mangligot, ang inyong public information ng Santa Clara County. Isang mahalagang yugto ang naabot laban sa COVID-19 at 1 milyong unang doses ng bakuna ay naipamigay na sa Santa Clara County. Ang pagkakapantay-pantay na pamamahagi ng bakuna ay nananatiling pinagtutuunan ng county at kanyang mga partner sa pagtitiyak na ang lahat ng mga miyembro ng komunidad ay may akses sa mga bakuna. Ngayong linggo, naabot ng Santa Clara County ang isang pangunahing yugto sa pagsisikap ng pagbabakuna sa COVID-19. May 1 milyong mga kwalipikadong residente ang nakatanggap ng hindi bababa sa 1 dosis ng bakuna mula nang nagsimulang pagbibigay ng bakuna noong December 2020. Nangangahulugan ito na mahigit sa 62% ng lahat ng mga residente na may edad na 16 at mas matanda ay nakatanggap ng hindi bababa sa 1 dosis ng bakuna. Mahigit sa kalahating milyong katao, halos 1/4 ng kwalipikadong populasyon na 1.6 milyon ay ganap na nabakunahan. Sabi ng mga opisyal ng county na ang 1 milyong marka ay isang napaka-positibong yugto, ngunit pinapaalalahanan ang lahat na kailangang manatili sa tamang landas sa pamamagitan ng pagsusuot ng maskara, pagpapanatili ng kanilang distansya at magpabakuna. Ang County ng Santa Clara ay nagpapatuloy ng matinding pagsisikap upang masarado ang puwang sa pagkakapantay-pantay sa pamamahagi ng bakuna. Nagpapatuloy ang outreach sa komunidad sa mga lugar ng East, San Jose at South County, kung saan ang mga residente ay lubos na naapektuhan ng pandemya at maaring humaharap sa mga hadlang sa pagbabakuna tulad ng mga hamon sa teknolohiya at transportasyon. Nagtatrabaho ang county upang matiyak ang pagpapalawig ng mga oras sa gabi at sa Sabado at Linggo. Pagdirekta sa mga mobile team na abutin ang mga naapektuhang kabahayan, manggagawa at mga mahihinang residente, at nagtatrabaho kasama ang mga leader ng komunidad na tumulong sa pamamahagi ng impormasyon tungkol sa mga bakuna at kung paano i-access ang mga ito sa maraming wika. Ang mga appointment ng pagbabakuna ay kasalukuyang available at ang mga bagong appointment ay ipinapalabas araw-araw. Regular na i-update ang website ng county sa 5 wika na may pinakabagong impormasyon tungkol sa mga bakuna at pag-i-schedule ng mga appointment. Ang impormasyon tungkol sa kwalifikasyon at pamamahagi ng bakuna ay makikita sa sccfreevax.org. Maraming salamat po.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.